Are you feeling a bit stuck with your career journey and just wondering what are some of the things that you can do to further your career? In this video, I'm going to give you things that I did and I'm doing that has helped to further my nurse career. Hopefully you'll find this useful and be able to test this out practically in your work. Hi. For those that are new here, my name's Sabrina Phillips. I'm a service director in the NHS, but more recently, I've also taken on an interim Deputy Chief Operating Officer role, which has been really exciting. On this channel, I give you the tips and tricks to skyrocket your nurse career. In today's video, I want to talk specifically about 3 different opportunities that I have taken over the last 19 years of my nurse career journey to get to where I am. And the first one is fixed term contracts. And for those of you that have been watching my channel for a bit, you'd have noticed one of my first videos is where I talked about my journey of becoming a nurse. My very first role in the NHS was a 2-year rotation program, which enabled me to move from a D to E grade. The opportunity that I took that's really, I think, helped in terms of the way I view opportunities going forward, because I later went on to do, again, fixed term roles in a quality improvement team. And that really helped me in doing a trust-wide role, which I think, again, has given me lots of experiences in project management, quality improvement, secondments. And essentially, if you're going to take this opportunity, do look at the policies, because you do need to speak to your managers and get their agreement for you to go on secondments, because if you go for a secondment not having spoken to your manager, you can be told yes. And I remember doing that in a previous role, and I did get the secondment role, but however, because I hadn't spoken to my manager about it, I was unable to take on that role. And even though I reached out to the head of nursing and another colleague who was a team leader, because I hadn't followed due process, I was unable to take that role. So that helped. A key lesson for me is ensuring that you check the policies and follow what the policies or guidance says. But in terms of other secondment opportunities that I've done, I did a team leader role at the very start, and this really helped me to really understand about managing a team, but also, is that something that I really wanted to do? The other secondments that I have done is head of nursing roles before I actually got appointed into permanent roles. And I think what's important with these opportunities, you might be curious about working in an area, you might not be sure if that's the area that you really want to work in, but they're an opportunity of a secondment, so it might be 6 months, 12 months, comes up for you to go into that role, really learn about it. It helps to build on the skills, your knowledge, your experience. It helps you to build your networks. It even helps maybe to give you some stretch targets. So one of the key things I'd say for any of these opportunities is have some key objectives or some key outcomes, because again, this is how you then use it in terms of your career progression, because you're then going to be able to say, whilst I did X, so for example, one of the secondments I spoke about, I did a head of nursing role where I supported the nursing directorate, and 2 of the key things I needed to do was around supporting our 3rd-year students to have a process where we're giving them guaranteed jobs at the end of their placement. And now that's an unusual thing that's happening across the trust. The other thing that I needed to do was write a learning disability strategy and job role, because there wasn't one for the trust. And it really gave, I learned a lot, because what I realized quite quickly is I didn't really understand what the structure of writing a strategy was, and it enabled me to work with the strategic director in the trust to understand what that structure looked like and what I needed to input into it. So I'd say do go for secondments, do follow the policies, but ensure when you're on those secondments, you've got very specific objectives that you're working to. Make sure they're smart, make sure that you can achieve them at the end of it, because it will help you in future jobs. The other area is around acting roles, and currently, for those of you who are eagle-eyed, you'd have heard that I am not only a service director, I'm acting into a deputy chief operating role. So there was an expression of interest put out for cover for a specific period, and I thought, it's somewhere I want to go. It's my, in my own career plan, it's my direction of travel. And again, it was for a specific period. It's about 10 weeks. It helped me with two things. One was around the application process for a role like this. I had to redo my curriculum vitae, or my CV. So it really helped me to look into all the things I've done over the years and make it as succinct as possible. I don't think I succeeded in making it succinct, but it made me think about what can I offer in terms of these 10 months, in 10 weeks, in helping or in acting into this role. But secondly, again, it goes back to having key objectives, is understanding what I'd be expected to do in these 10 weeks. And I'm doing this role alongside my director role. So again, it's making sure I've got the time and capacity to meet those outcomes. And I've got two exciting projects that I am working on. And again, it's bringing me into contact with colleagues I haven't worked with before. So this acting role has given me exposure to working with other parts of the organisation that I haven't really had to work with. But also I've had the opportunity of going into more wider and bigger system conversation, again, that I wouldn't have been party to in my usual role. So again, it's helped me to expand my network, to expand my knowledge and understanding how decisions are made, the different frameworks or documents that need to be filled in, and the rationale behind it. So if you've got the opportunity to go for an acting role, I really, really suggest that you go for it. But also, again, it comes back to, and you'll see there's a trend here. What's the policy around it, but also what are the key objectives that you'll be expected to do, and have you got the time to do that? And the last bit is just generic bank or agency work. And I don't do any bank work anymore, but when I first started out, I would work bank not only on the ward that I worked in, but also did for a very short time agency, where I did some shifts in private healthcare, and that just gave me the opportunity to see how different organisations work, because in the UK we've got the National Health Service, but we also have private services as well. And it just gave me very low level, because I was working as a band 5, so I can't profess that I know the inner workings of private healthcare, but it helped me to understand where we sent some of our patients, some of the policies that these organisations worked with, but also really made me think about how we treat the staff that work with us, who work as bank and agency for their own reasons, and ensuring that they have a good experience as well. Because I can say not all of my experience was great, and people view you in different ways, but it made me really think about how I work with colleagues, and how I ensure that other colleagues work with people who are covering as bank and agency nurses. So that's it. These are the different types of opportunities. So I talked about secondments, fixed term contract acting roles, and doing some maybe bank and agency shifts. I talked about making sure you follow your policy and due process, but also being clear about the objectives that you need to set when you take these opportunities. But what I really want you to take away is that you will gain so much from doing these roles, and then it really helps you to think about if I want to, if you want to go down a particular role and there's an acting or secondment, it gives you that opportunity to test it out, to see if it's really for you, to really understand what other skills you need to build up. So I hope that was helpful. Let's be bold and brave together, and I'll see you on the next one.